I'm Thomas Styx, just completed my first week with Empire Surgical. On this video I'm going to talk about the anatomy of the knee. I'm going to break it down according to 5 elements: bones, ligaments, tendons, cartilage, and muscles. Starting with the bones, there's 4 bones. There's the femur, which is going to extend superiorly from the knee joint. There's the tibia, which is going to extend inferiorly from the knee joint. Directly lateral to the tibia is the fibula. And then there's the patella, which is going to be the most anteriorly located bone. It's going to sit directly above the joint space. Moving on to the ligaments. There's 4 ligaments. These are going to act to stabilize the joint and prevent hyperextension and dislocation. First being the anterior cruciate ligament, or ACL. The ACL is going to run from your posterior lateral femur to the anterior medial tibia. Then there's the PCL, posterior cruciate ligament, which is going to cross the ACL, extending from your anterior medial femur to the posterior lateral tibia. The medial collateral ligament, or MCL, is next, extending from your medial femur to the medial tibia. And lastly, there's the LCL, or lateral collateral ligament, which will extend from the lateral femur to the lateral fibula. Moving on to the tendons. There's 2 tendons here, which connect bone to muscle. There's going to be the patella tendon and the quadriceps tendon. Patella tendon extends from the patella inferiorly down the tibia, and the quadriceps tendon will extend from the patella superiorly up into the quadricep muscles. Next we have cartilage. There's 2 types of cartilage we're concerned with. There's the articular cartilage, which is going to cover the distal end of the femur, which actually is in the joint space. It's going to act as a lubricant to allow freedom of movement during flexion and extension of the joint. There's also the meniscus. There's what's referred to as a lateral and a medial meniscus, which are going to act as shock absorbers to prevent the femur from bumping into the tibia. These are also broken down according to their vasculature as the white-white, red-white, and red-red zone, the red-red having the most vasculature. Next we have the muscles. There's 2 groups of muscles we're concerned with: the quadricep muscles and the hamstring muscles. The quadriceps are located anterior side of the femur. There's 4 of them. Moving medially to laterally, we have the vastus medialis, the vastus intermedius, the vastus lateralis, and then there's the rectus femoris, which is actually going to sit directly on top of the vastus intermedius, more superficially. Going to the other side of the femur, the posterior side. Again, moving medially to laterally, we have the hamstring muscles, starting with the sartorius muscle, the gracilis muscle, semimembranosus, semitendinosus, and then the biceps femoris. These are all going to act in flexion of the knee joint. So those are the basic elements. We have the bones, ligaments, tendons, cartilage, and the muscles. Hope you've enjoyed watching my video. I'm Thomas Styx.